Welcome to this demonstration video on how to use the iCare HIV Test Kit. Detailed instructions can also be found in the package, either on an instructions insert or printed on the back of the test kit packet. Please follow all steps carefully. Opening the main package, you will find an alcohol prep pad, a lancet, a diluent bottle, a micropipette or dropper, and a test packet. In the test packet, you will find a plastic test cassette and a moisture-absorbent packet. The moisture-absorbent packet is not used for the test and should be discarded. Begin by placing the test cassette on a flat surface. The test cassette consists of two main parts: the well, where you will place your blood sample, and the result window, which will show the result. Open the alcohol pad and sterilize the finger to be tested. You will get the best results drawing the blood from the inside surface of the finger. Clean the entire tip of your finger by rubbing thoroughly with the alcohol prep pad. Next, prepare the lancet by turning the yellow key twice and pulling to remove. The lancet is now ready for use. Press the open end of the lancet firmly against the sterile area of your finger. Then press the side button to release the needle. The lancet will then prick the finger. Dispose of the lancet with care. Using the micropipette, gather a drop of blood from the finger. You may need to squeeze your finger several times to produce enough blood for the sample. Next, add 1 drop of blood into the well of the test cassette. Then add 2 drops of the diluent solution. After 15 minutes, review the test cassette. Do not read the results after 20 minutes. A single line in the result window at the C position indicates a negative result. A negative result means the sample indicates that you do not have HIV. However, note that for a newly infected individual, there is a window period whereby the HIV virus could be present, but its antibody levels cannot be detected yet. So in order to confirm your negative status, you are advised to conduct a second test in 3 to 6 months. 2 lines in the result window at the C and T positions indicate a positive result. A positive result means the sample indicates that you have HIV. You should visit a licensed medical professional immediately for further testing. Early diagnosis allows for more effective treatment. If no lines appear, or if the line appears at the wrong position, the test is invalid. You should test again with a new kit. Never reuse a test kit. Please dispose of all test kit components safely after reading your result. The test kit package includes a guide for interpreting the results. Thank you for choosing iCare. Please visit our website if you wish to order an HIV test kit.